Hi, this is Dr. Phil Borders. I'm a psychiatrist at Hendricks Therapy, offices in Plainfield, Danville, and now we have a new office in downtown Indianapolis. And today we're going to talk about dementia. We've already had some discussions about memory, and as we discussed last time, with aging there is a normal process of decreased memory, and that tends to affect our frontal lobe. And our frontal lobe is in charge of memories that are temporal, basically memories that lie in a sequence like A causes B causes C, and there are also prospective memories, and those are memories about what we need to do in the future, such as we need to go pick up a birthday card for our wife, we've got dinner plans with the Albertsons, and that's where calendars can help a lot with older folks who have difficulty with those memories. Now, progressing from normal memory loss is called mild cognitive impairment. That is, again, more than normal aging. That's where the person's family usually can kind of pick up that their parent, their grandparents, not doing so well. The person can maintain full independence, but you can kind of tell that they're just not quite as sharp as they should be. That it's more than just a little bit of memory impairment. Progressing further, then you have dementia. Now, dementia is not a diagnosis. Dementia is a term which encompasses basically a group of symptoms and groups of types of dementia. The most common would be Alzheimer's disease. So again, dementia is not a disease. Dementia is just an all-encompassing term. Now, Alzheimer's is the most common type of dementia. It happens to about 60 to 80% of people with dementia. And what Alzheimer's is a progressive, slow neuronal loss. So it happens over a period of years where people have this kind of slow but continual decline because basically their nerve cells in their brain are slowly dying. After Alzheimer's, there's cerebral vascular disease, which is basically strokes. Now, strokes happen when you have a clotting of your arteries in your brain, which then blocks off the oxygen supply to those nerve cells, and those cells die. Now, it's more of a stepwise decline. So where dementia is more like, Alzheimer's is more like this. Cerebral vascular disease would be more like this, where you'd have a series of strokes leading to cell death and then eventually death itself. The third most common is Lewy body dementia, and that happens to about 15% of people with dementia, and that's when people's nerve cells in their brain get these protein deposits in the cells, and the protein deposits then basically make the cells non-functional. The fourth most common type of dementia is frontotemporal dementia, or Pick's disease, and that happens to people who are under the age of 65. Now, when people have dementia, they start having difficulties in all four main quadrants of their cognitive functioning. The first is their memory. When people have dementia, they tend to maintain better older memories, and they tend to lose newer memories quicker. So the newer the memory, the more likely the memory is not to be encoded well, and the older the memory, the more likely the memory is to be encoded and then being able to be retrieved. So as far as memory, in the cognitive state, it tends to affect older memories less, newer memories more. Dementia also affects people's language, affects their ability to read, their ability to speak, also their ability to understand language, understand what they're reading, understand what they're listening to. So it affects that also. Another domain that it affects is the visual spatial domain. That's the area of our brain that helps us be oriented to where we are, where we're going, That's why people with dementia tend to get lost. It affects people's ability to read maps and just understand where they are in relationship to the world. Finally, it affects our executive function. Our executive function, as you remember, is our brain's secretary. It's our ability to reason, our ability to problem solve, our ability to plan. So again, it affects our language, it affects our memory, it affects our visual, spatial skills, and affects our ability to basically deal with the world. Another way of classifying dementia is just basically the severity. There's mild, moderate, and severe. Mild dementia is where people require a little bit of help, but they're mostly independent, and that usually lasts about a year or two. Moderate dementia is where the people definitely need help. That lasts 2 to 3 years. Severe dementia is where people require almost total help. Now that can linger all the way up to 5 years. So it's pretty rare when somebody gets the diagnosis of dementia to live more than 9 years. I've certainly seen people live longer than 9 years, but for most people it's a progressive decline that will eventually take their life before 9 years or so. So not real uplifting. Thankfully, it's not very common before the age of 65. Unfortunately, by the age of 95, about 50% of people have dementia. Next topic, we're going to discuss treatment for dementia, and we're also going to answer the question, when my parents has dementia, does that mean I'm going to get dementia? Hope this was helpful, and I'll talk to you again.